Almost everything I'm going to tell you about this week is chosen. The outbreak we can no longer count, the disease we eliminated and then brought back, and the capacity we dismantled on purpose. This is a week where the biggest stories were not exclusively acts of nature. The largest cyclosporiasis outbreak in American history is spreading through a food chain nobody can see the far end of. The division of CDC that worked on parasites like Cyclospora no longer exists. Measles has passed all of last year's case count and is establishing endemicity in a country that eliminated it. Ebola is killing more people in the DRC at a faster rate than any other outbreak of Ebola on record. And the American response to Ebola has been to seize returning citizens at the Canadian border. There has been good news, though. There has been important drug development, and that's something to celebrate. However, there is a dark side to that because once drug development occurs, you often find people clamoring for companies to bleed. I'm going to start talking about the Cyclospora outbreak, which is the largest Cyclospora outbreak in the United States history. It's now over 10,000 cases, and multiple states are being added to the list, including my home state of Pennsylvania. Michigan remains the epicenter, and it's hit so hard that it's running out of reagents to actually test for the parasite. And that just tells you how much testing is being ordered. It's important to recognize that this is not just one outbreak. There is a major component of the outbreak that is related to Taylor Farms and lettuce and an affiliated Mexican farm and possibly a processing plant. But there is another outbreak that the FDA is investigating, a cluster of roughly 72 cases that doesn't link directly to the Taylor Farms lettuce. And remember, there are hundreds of travel-related cases. Many states have a mix of all of these things going on, including my home state. The Mexican processing center run by Taylor Farms has been temporarily closed. Whether or not this is the source, I think will kind of bear out over time, but look to see case counts. Are they plateauing? Are they still increasing? And Taylor Farms has been involved in cyclospora outbreaks in the past. There was a false positive PCR that was in the news that FDA was testing batches of material from Taylor Farms, and one tested positive and it turned out to be a false positive. This wasn't part of the outbreak or the recall lettuce, and it doesn't actually change anything because it's the actual field epidemiology, the investigations, the interviews that actually establish the link with Taylor Farms. And the press releases from Taylor Farms have really misconstrued this. Stay away from the recalled products until this thing gets sorted out. And there's been, some confusion over the recall because they didn't actually name the brands or the products, but use codes. That's not a good way to do this. The FDA doesn't require them to actually name things, but it's really disingenuous to just put codes there when you're expecting consumers to be able to trace this or link this to products that they may have purchased or see on the shelves. The Taylor Farms CEO called the White House. This is a group that's donated to the president's political action committees. The White House has no expertise here. The calls should be to the FDA, to the CDC, to the state and local health departments. We're in a mixed economy. It's hard to know what's cronyism, what's legitimate concern, but this whole thing doesn't pass my test at face value that this seems to be done with ill intent. The mechanism for the cyclospora outbreak remains the fact that it is the irrigation water that is contaminated with human feces. And oftentimes water might be treated for bacterial pathogens, but not parasitic pathogens like cyclospora. And that might give people false reassurance. It doesn't matter what the brand name is or if it's been in a warehouse. It really matters where it's grown. So when you think about buying local, that may look like an answer, but it matters where the produce was grown and what the irrigation water looked like. Not the brand name, not whether you bought it at a farmer's market. The parasite thrives in tropical and subtropical regions. That's how that gets into the fecal. It infects people. Their fecal matter gets into the irrigation water. In general, U.S. municipal water supplies are not contaminated with human feces. So this isn't something that you would see in a temperate climate like the United States in the produce grown here. Cyclospora causes explosive diarrhea, and there's a lot of people presenting to emergency departments, to doctors' offices, urgent care centers with concerns about cyclospora. Many tests are being ordered. As I said, Michigan is running out of reagents. I've been sending some tests, and incidentally, I found an enteropathogenic E. coli in a patient of mine who thought they had cyclospora. So you may see other foodborne illnesses or pathogens increase because there's much more testing going on as people are presenting with diarrhea. The capacity to handle this and manage this outbreak, that's the underlying story. FoodNet's been disrupted. State and local health departments are funded below what they've requested. And as I said earlier, the CDC division that housed the Cyclospora parasitic disease work, which is also where the president's malaria initiative sat, that's been largely eliminated with staff dispersed. Michigan and other states are leading this investigation rather than the CDC, which has been largely reactive, which is not surprising if their expertise has been diffused. It's not, and it's been dismantled. Again, look to see, is there a plateau in cases? We know that this is that the shredded lettuce has been recalled. We'll see exactly what's been eaten, what's been thrown out by now. We'll start to see the numbers start to get more granularity. And despite what RFK Jr. said, this is not yet under control. And in general, when it comes to RFK Jr., just ignore him. I'm going to move now to Ebola in the DRC. So we've got over 1,000 deaths and more than 2,300 cases. This trajectory is the fastest death accrual of any Ebola outbreak recorded, which tells you that the momentum is not breaking. This is only the third Bundibugyo outbreak ever. So the evidence base is fairly thin. We don't have a lot of case histories. There's an interesting story published about a week ago by the Bloomberg journalist Jason Gale talking about the fact that Bundibugyo species may be less severe, meaning people can walk around with Ebola and spread it longer. But that also gives you an opportunity to use antivirals because the viral load may not have peaked. So you might have a wider therapeutic window to use antivirals like remdesivir, like obeldesivir. The issue with burial and safe burial practices still is a major issue. Bodies are being moved between provinces. And remember, these corpses are not benign. They carry high viral loads and drive transmission. Suspected that body movement had seeded at least one newly affected province in the DRC. Safe burial practice is a major choke point in this outbreak. Another major choke point is that there are more than 260 armed groups operating across North Kivu in Ituri province, which is where this outbreak is centered. There's also a healthcare worker strike going on. There's more and more centers having strikes because people aren't being paid and they're doing very risky work. There was a really important story in Rolling Stone reported by Catherine Eben. The United States has issued something called a Title 49 order, which basically makes anybody that's been in the DRC within 21 days, it puts them on the no-fly list. So about 13 or so people were trying to get home over land through Canada, and they actually got seized at the border. And this was on an order of the acting CDC director, and they were housed at Fort Drum. They were released. This just shows you kind of the chaos and the way that they're misplacing what to do in an Ebola outbreak, that they're seizing people who pose no risk to others over this kind of Title 49. Couple that to the fact that there's asymptomatic Americans being held in Kenya on cots at a military airport facility. None of this makes sense. They can be monitored at home, just like in the 2014-2015 outbreak. And remember, this isn't being done because of scientific or medical reasons. It's a political goal to try and keep Ebola cases to zero in the United States. And it wastes taxpayer money by leaving the 13 Ebola treatment units that are expert at dealing with all of this completely fallow. Uganda has worked through its 20 cases of Ebola, and it's in the 42 countdown day period to be declared Ebola-free. They have travel bans initiated against them from the United States and 14 other countries. These bans never should have been imposed. Lifting them is correct, and Uganda is lobbying for that. But Uganda still owes the world transparency on its Marburg case or cases. We still don't know exactly what happened with Marburg in Uganda. There's been some interesting science relating to vaccine cross-protection. A New England Journal of Medicine letter to the editor shows that recipients of the Zaire-targeted vaccines, both the Merck and J&J versions, do form antibodies against the Bundibugyo species at a lower level than against the Zaire species, of course, which is what you would expect. Whether that's protective is unknown, but there is at least some anecdotal signals that previously vaccinated people in this Bundibugyo outbreak are not among those that are dying. So there is at least enough signal to think through this. There is a Bundibugyo-specific vaccine that's entering phase 1 clinical trials in both Uganda and the UK. And there's also a strategy of using the Zaire vaccine and then following it with an experimental Sudan species vaccine to see whether cross-protection can be built. It seems to work in animal models that way. All of this is better than nothing. It's going to be interesting to see the immunology, and I think it really speaks to real-time clinical research going on in the middle of a major outbreak. With Diagnostics, a Pennsylvania company called OraSure got an emergency use authorization for a rapid antigen test that covers all of the species of Ebola that infect humans, the 4 species known to infect and cause disease in humans. This is likely going to be pre-positioned, used in the field, and I think it's a major step forward in diagnostics with Ebola. Remember that this species of Ebola wasn't picked up with the standard tests. It's really, I think, incumbent to make tests that can look for all of the dangerous species of Ebola. Now, moving on to measles, what we're seeing right now is the establishment of endemicity with this virus. Over 2,200 cases, and that's likely an undercount. There are 34 active outbreaks. And if you look at modeling, people are saying that the Texas or the Utah-Arizona border outbreak is probably 2x to 3x bigger from mathematical models than what the actual numbers are. The last years that we saw numbers like this was around 1990, 1991. 50% of cases are between the ages of 5 and 19. This is precisely the cohort that should have robust immunity from doses in their childhood years. That demographic really shows you parental vaccine refusal driving this outbreak. My home state of Pennsylvania is at 114 cases. It's a record year, or 114 plus by now. The state health department standing up a dashboard. Delaware reported its first case in 10 years, then declared an outbreak in Kent County involving 4 unvaccinated adults. State measles dashboards are going to become the new normal. The National Foundation for Infectious Disease now issuing clinician guidance and resources for measles. So we're basically publishing instruction manuals for a disease we had eliminated. Seems akin to publishing an instruction manual for a VCR that somebody decided to bring back. We have anti-vaccine bills being introduced in many state legislatures, the majority by Republicans, and most are not passing, thankfully. What is happening is that legislators have concluded that pandering to the anti-vaccine movement keeps them in office. They optimize for the next election, not for what is true, not for what reality says. People keep asking me, do they need a booster? For most adults with measles boosters, the answer is no. There may be some benefit in immunocompromised patients, those who've had an organ transplant, bone marrow transplant. They don't hurt, but they may not necessarily be effective in someone who's gotten the standard vaccination. Just remember, what you're seeing now was voluntarily chosen. We are watching in real time a virus that was eliminated reestablish itself through human action and people wanting to accept or live in a lower standard of living. I'm going to now talk a little bit about some of the institutional capture that the anti-vaccine movement has accomplished. The National Vaccine Advisory Committee, RFK Jr., has basically rewritten the charter. And this speaks to the fact that even when he's not on television spreading disinformation, he's doing structural damage behind the scenes. And he's very effective at it. He's been doing this for decades, and he knows every pivot point. He knows how to do this. He knows how vaccine policy is made in the United States, and he's executing. The CDC director designee, Dr. Schwartz, now seems to have the votes to get out of committee. And Senator Cassidy, the physician, was again a pivotal person in this hearing. And what changed his mind was a wording change on the CDC website, softening some of the language regarding autism and vaccines. It's still very nebulous and it's still not true, but the bar is basically on the floor when it comes to confirming these people and what they'll accept in terms of softening of the language. This is an RFK Jr. nominee, and he may not completely like her, but he had to have signed off on it. And Senator Kennedy may believe he's driving this process, but I think it's still RFK Jr. Just look at the ASPR designee, Sean Kaufman. He basically reads as an anti-vaccine advocate, walking back positions he probably still holds, which kind of were illustrated when he waffled on mRNA vaccine technology. It's a good thing that he lacks the votes. You do not want someone who denigrates one of our best pandemic technologies in charge of the pandemic vaccine stockpile. The CDC nominee, Dr. Schwartz, is a more complicated case because she appears to talk out of both sides of her mouth in order to placate RFK Jr. I think the rule should be, your goal should be to anger RFK Jr. because if he agrees with you, something has gone wrong. In the Department of Defense, the military COVID vaccine requirement was initiated for force protection, and that was rescinded. It made sense for people living in barracks and training camps, and now they're trying to reinstate personnel, and it's been a big bureaucratic mess. And the interesting part of this is that the military's own data showed that the vaccine protected soldiers against severe disease. This is the same pattern you saw with the influenza vaccine requirement being rescinded when you saw then afterwards a major influenza outbreak, including a fatal case. There was a good story in the Pittsburgh Post-Gazette talking about a group of Pittsburgh pediatricians who got attacked in 2017. It was one of the kind of first volleys online against people who were advocating for vaccines. Pediatricians, including Todd Wolin, who's a friend of mine, were advocating for the human papillomavirus vaccine. And they got hit with a major backlash. But what they did is turned it into something really good. the Trusted Messenger program, which studies and helps guide how people with questions about vaccines can be reached and avoid them getting pulled into the anti-vaccine movement. And I think that this is something that's become very common now. Every time I talk about vaccines, I get attacked, but that was one of the first ones, and it was pretty explosive. There was an op-ed in CIDRAP by Jake Scott on how people process vaccine data. And there's one sentence there that I just want to read out loud. A belief no possible evidence could ever have unsettled was not resting on evidence in the first place. And I think that's what we have to come to grips with. That there are some people that are basically impervious to evidence. I want to now move to some of the good things that happened relating to some of the drug development news. So one of the big stories was Merck's almatrelvir. It is a late-stage development, pre-exposure prophylaxis, one pill once a week for HIV. It's not an injection. And Merck is negotiating a whole bunch of agreements with generic manufacturing to make it easier. But there's a criticism that this is good, but not enough. And I would say that some people will not be satisfied unless companies like Merck actually lose money. I think it's nihilistic, spiteful, and envious. The same thing happened to Gilead over lenacapavir. Merck deserves credit and deserves an adequate return on investment because that return is what funds the risk-taking, the manufacturing, the fill finish. It turns a drug into an actual product. These things don't grow on trees, and it's just for Merck to get an appropriate return on investment. Islatravir from Merck plus Gilead's lenacapavir, another breakthrough in HIV, once weekly, looks very good. It's a simplification of antiretroviral regimens, and evidence and innovation is still moving. Olorifim is a antifungal medication, late-stage development, and it has activity against coccidiomycosis or valley fever. This is important because the antifungal pipeline is very thin, because remember, humans and fungi are both eukaryotes. Our cells are very, very similar, so it's hard to find a target that just attacks one and not the other. This drug, Olorifim, in coccidiomycosis in immunocompromised patients, shows that it works, and it's something that may be even better than what we use normally, itraconazole, for example, which people have to be on for a very, very long time. Nirsevimab, it's the dominant monoclonal antibody used for RSV prevention in infants, also protects infants against pneumococcal infection. RSV predisposes to pneumococcal disease, so if you prevent or blunt RSV, secondary bacterial infections never get that opening. So monoclonals in the newborn may be the better route here when it comes to protection against both RSV and pneumococcal pneumonia, but you can obviously also vaccinate pregnant women. Some more diagnostics news. Cepheid is shifting Gene Expert, which is a major PCR panel from microtubules to semiconductors, which broadens the range of targets. I think that's really important because you want to not necessarily have to make kind of stepwise choices. I test for these, then I test for these, and I test for these. If you can test for everything, you're going to get better at diagnosis. Allplex received FDA clearance for a multiplex PCR for skin ulcerative diseases, herpes simplex, mpox, varicella zoster. I think this is important because these types of ulcers and skin lesions are ambiguous at the bedside. And I talked about OraSure's Ebola emergency use authorization. One of the key causes of mine has always been better diagnostic testing. I've talked about the fact that tier testing leaves too many diagnoses on the table. We run 3 tests and 2 more and then stop. Cheap, fast, high throughput point-of-care multiplexing is how you actually find out what is making people sick, and you minimize the biological dark matter. A couple of last things I wanted to mention. There was an article in the Wall Street Journal talking about artificial intelligence and biological weapons. I would just say that artificial intelligence, like many things, is a dual-use technology. I think it will prove to be a much greater force multiplier for biodefense than for bioterrorism. And the goal should not be to slow AI. It's to make sure that the defense benefits outpace the offensive one. There was a recall of cold brew coffee from Brooklyn Roasting Company relating to potential botulism. Remember, botulism is caused by a toxin. It causes paralysis. There's no human cases, but they believe that this was held at room temperature, and now that bacteria might have been able to thrive in that cold brew. We'll have to see if any human cases are attached to it. And then a fun fact for you, thinking about swimming pools and infections there, just remember the average swimmer sheds about 0.14 grams of fecal material during recreational swimming. That's why chlorinated pools are very important. So I wanted to just sum up with the week with the Jake Scott sentence. Some positions are impervious to evidence because they were never built on it. They function as fixed ideas. closer to religious conviction than to empirical claims. And that's what you're dealing with RFK Jr.'s mind and many of the anti-vaccine movement's mind. When you think about the through line between Cyclospora, measles, the nomination fights, it's all the same story told in different ways. Capacity, expertise, immunity, all voluntarily given up, each one now being replaced by a dashboard, a lawsuit, a press release. Next week, watch to see what happens with Cyclospora case, whether the Taylor Farms Mexico facility yields a contamination point, whether the Ebola death curve starts to bend, what happens with the CDC and ASPR confirmation votes, and also keep an eye on the New World screwworm count in Texas as it is increasing.